and good evening mga arthritis warriors. I'm Dr. Jonathan Flordelis and you can call me Doc Joff. I'm your Cebuano hip and knee specialist. A little bit about myself. I'm a practicing orthopedic hip and knee specialist here in Cebu City. I did my residency training in Orthopedic Center, Quezon City. I did my hip and knee training in Ballarat, Australia. And I further trained in hip and knee reconstruction surgery here in Chonghua, Cebu City. So a little bit more, we are promoting awareness on hip. That is, the real hip is the groin pain. If you have sakit sa singit, sa bugan, or sa punuan, it may be hip AVN, hip arthritis, hip dysplasia. We don't know unless you see a hip specialist near you. Again, we are promoting awareness on AVN, also known as a vascular necrosis of the hip. It is a hidden crisis here in Asia because in Asia, we have 60% of hip replacements in patients with AVN or a vascular necrosis of the hip. That means patients as young as 20 years old can get already a hip replacement surgery because of their bone being dead. AVN is basically bone death. AVN of the hip means your ball socket joint becomes destroyed because the femur, the head of the femur, is dying. And this is why, again, if you know someone with groin pain, sakit sa bugan, sakit sa punuan, that radiates to the thigh and also the buttocks, please see a hip specialist near you. It's very important that early diagnosis be done on patients with groin pain because it could be AVN. We may have a big chance of saving patients in their early stages only. If it becomes a late stage AVN, the prognosis becomes very poor. We may not be able to save the patient. Remember, the true hip joint is in the bugan, the singit, and that is here. It is not here in the, they say this is the hip, but that's not the true hip joint. Remember, the true hip joint is in the groin, singit, bugan, punuan, and it goes to the thigh and buttocks area. That is the anatomy. Blood supply is disrupted. If there is no blood that goes to the bone dies. This can happen for many cases. It could be you are a high-risk patient. Remember these three things. Number one, are you someone who is using steroids? Steroids could be prednisone 5 milligrams, 10 milligrams. It could be methylprednisone. You could be using steroids for asthma. You could be using steroids for lupus or SLE. Whatever it may be, rheumatoid arthritis, they use steroids. You are at risk for AVN. So always remember and ask your doctor about these side effects. Ask your doctor if you have groin pain, sakit sa bugan, sakit sa punuan, that radiates to the buttocks and hip. If you have stiffness and you cannot do a figure of 4, that means you cannot do a de cuatro. So if you can see me doing a figure of 4, if you cannot do this position anymore, it is possible that you may be having something going on in the hip. We don't know what it is, so always consult your doctor. Now, when we're talking about AVN, also known as avascular necrosis, osteonecrosis, or bone death, the bone slowly dies over time. There will be times na severe ang pain, and it's worse at night. The stiffness also worsening, and you start limping. You will start needing a cane, a crutch to support yourself. Those are signs and symptoms that our AVN is getting worse. And again, the average age of these patients is not 60, 70, 80 years old. the average Asian with AVN is about 30 to 40 years old. So patients very young. I've had patients as young as 20 years old from different parts of the Philippines with AVN of the hip. And it's so sad that we are not able to catch this early. So remember, guys, AVN, bone death of the hip. If you have groin pain, sakit sa singit, bugan, or punuan that goes to the thigh and buttocks, please consult a doctor near you. And remember, if you're getting a value from this cast, please like, follow, and share this with your friends. Right now, we are broadcasting live from Cebu City. And I'd just like to take time before I continue that we are doing a free consultation for AVN for hip or groin pain and knee pain, that is sakit sa tuhod ug sakit sa bugan. If you have these, you can see me at the clinic doing a free consultation. That's on August 27, 28, and 29, doing a free consultation for tuhod and sa sakit sa bugan, sakit sa singit, punuan. August 27, 28, and 29, I will be at the Cebu Orthopedic Institute, and that is across Chongwa Hospital, 4th floor, Robinson Cybergate, and they're 10 a.m. That's 10 a.m. to 3 p.m. Please schedule in advance. So it's not going to be first comes, first serve. Unfortunately, we need you to schedule in advance. So we pre-schedule patients for these dates: August 27, August 28, and August 29, 10 a.m. to 3 p.m. Not first come, first serve, but appointment basis only. And the details will be in the comments below so that we can see you, your tuhod or your knee or your groin or your hip. If you have MRI scans, if you have had x-rays, please bring them with you. Again, this is at Robinson Cybergate at the Bone and Joint Center, which is also known as COI, Cebu Orthopedic Institute, August 27, 28, and 29. That is 10 a.m. to 3 p.m. Look for me, Dr. Jonathan Flordelis. You can call me Doc Joff, hip and knee specialist here in Cebu. So moving forward, mga arthritis warriors, we're talking about AVN, we're talking about bone death, and what happens in a normal hip that can cause it to die. Number one, we talked about steroids, prednisone. So please don't just take steroids. Always understand these have complications. The other thing that we want to watch out for is actually you start limping and you have groin pain, more pain at night. What is the other risk factor that I want to share with you? If you are taking alcohol regularly, a lot of patients don't know that alcohol and cigarettes, they can cause inflammation inside the body, destroying slowly different parts of the body. They block the blood supply, and sometimes it's the blood supply to the groin or hip. Remember, sakit sa bugan, singit, or punuan could be AVN. Smoking, drinking, inflammatory stuff like that can destroy your ball and socket joint slowly. And remember, it's very difficult to catch this early. That's why we're promoting the awareness for avascular necrosis of the hip, also known as AVN. 97% are misdiagnosed initially, and there is a delay in diagnosis of at least 5 years before we can actually find out what's happening to these patients. So we're also promoting the AVN Warriors Philippines group. If you know someone with AVN, join the group. So like this, follow, and share this with your friends, especially if you know someone na AVN, avascular necrosis, here in the Philippines, or if you are a Filipino abroad. The AVN Warriors chat group is a group of Filipinos all around the world. Some have had surgery, some have not yet had surgery, some are being treated for AVN. So thank you everyone for listening. If you have questions, Let me know in the comments below. Type down where you are from. Type down, hi, Doc, I'm from Cebu City, I'm from Bohol, I'm from Leyte, and then ask your question and we will get back to you. So let me know if you can hear me loud and clear. Comment below which city you're from, and if you have questions about the hip or knee, this is also the time that you can ask me, Dr. Joff, Dr. Jonathan Flordelis, your Cebuano hip and knee specialist. We're doing an Ask Dr. Joff segment. If you have questions, comment below after typing where you are from, if you are in the Philippines or abroad. Again, remember, AVN can be caused by number one, prednisone, steroids. Number two, we're talking about inflammatory substances like cigarettes and alcohol. If you're regularly smoking, regularly drinking, it's not good for you. Then we also talk about the limping, the groin pain that goes to the thigh, that goes to the knee, and that goes to the buttocks. Those are the symptoms of hip pathology. The third risk factor that I want to share with you, if you've had injury, possibly a fracture around your hip, a dislocation around your hip, that can cause a vascular necrosis or AVN of the hip. So we have a question from Sir Lorenzo. And Sir Lorenzo, remember to comment where you are from. Doc, how serious is AVN po? So thank you for your question, Lorenzo. AVN is relatively serious because when the bone dies, there is a bridge that cannot be crossed again. When you lose your bone, nothing can replace it better than the bone that you normally have, because hip replacements are meant to last 40 years, 40 plus years, and that is with the newest technology. But we human beings are living up to 80, 90, 100 years old. That is why in some patients, it's prudent to delay a joint replacement surgery, and early diagnosis very important in a vascular necrosis po. I hope that answers your question, Sir Lorenzo. Please like, follow, and share this with your friends. And if you are someone with AVN, mga arthritis warriors, we have a separate Facebook group. We have a separate chat group for AVN patients here and abroad, so that we can help each other in this community. Those are the three most important risk factors. Of course, there are more risk factors for AVN, but the three you should know about: if you've had trauma to the hip, if you've had a lot of smoking, drinking, lifestyle, bad lifestyle like that, and of course, if you've had a lot of steroids over the years, 5 milligrams per day for a year can already cause AVN. So I hope that helps you guys. Remember to like, follow, and share this with your friends. We have a separate group. And if you want to join the AVN Warriors chat group, please comment AVN in the chat. And if you are from the Philippines or abroad, the AVN Warriors chat group is a group of Filipinos all around the world. Some have had conservative management, medical management, and some have had surgery or awaiting surgery. Let's help each other fight this disease. So we call it walking back to life. That's what I want to tell my patients. We want you to walk back to life, to get your life back, the quality that you have before the AVN. That's our goal. So, fun fact out there, before I commit to patients, I also want the patients to commit to themselves. It's very important na they commit to themselves. Otherwise, the doctor helping the patients would be useless. Remember, AVN best seen early because we can save your hip. That's why groin pain, sakit sa bugan, sakit sa punuan is something that I want to raise awareness to. If you are familiar with the actress Angelica Panganiban, she had tried injections, didn't work, she was still in pain. And if you follow her vlog, you guys have to check it out. She is an AVN warrior. She tried injections, didn't work, was still in pain. She tried core decompression, that is surgery to release blood into the hip. It didn't work, gave her more pain. Maybe something happened to the hip. It may have worsened her symptoms. And lastly, she had the joint replacement because it was already late stage AVN, and that is what gave her quality of life. Now she's walking. So again, mga AVN warriors is a separate chat group. That is a separate Facebook group. If you know someone with AVN here in the Philippines, remember those three symptoms: sakit sa singit, bugan, punuan, goes to the thigh, goes to the buttocks, and average Filipino, average Asian is about 30 to 40 years old. I've had joint replacements in my patients as young as 20, of course, as old as 102 years old for the hip. And I want you to know there are early interventions. I was talking to a friend about PRP injections, very good for early stage AVN. But if it's moderate to severe already, it may not work. Can you try it? Probably you can try. Probably a lot of patients would like to avoid surgery. But in the case of Angelica Panganiban, it made the pain worse. Core decompression surgery, where you drill a hole to release the blood into the hip. Again, very good results in early AVN, but no effect in late stage AVN. When you have already arthritis of the joint, it won't work. So when you have early arthritis or early AVN, core decompression, PRP injections may work, and joint replacement is last but not least for patients with severe arthritis already. Arthritis happens when the ball and socket are destroyed. When the bone is totally dead, it deforms. That's why imagine a car wheel that the wheel is no longer round. That's what's happening when the wheel breaks. So I also am a promoter of doing hip replacements without cutting muscle. We call this the anterior hip replacement technique. It is the modern techniques right now. Over 60% is being done in the US anterior hip replacement. Again, we do this without cutting muscle. We've been doing this since 2017, and I think this is the way moving forward. That's why we can get patients walking back to life, is what I like to call it. Walking same day as the surgery and discharge as early as 1 day after. So if you know someone who needs a new hip, always consult a doctor. No harm in getting a second or third opinion. I believe that patients should be able to be educated, should be inspired. And that's why our motto is to educate and inspire you. Because I have a joint restoration blueprint. That is why every patient is different. The 20-year-old is very different from the 100-year-old whom I did surgery on. Every patient is different, and there is a solution to everything. I hope you got value from this live. If you know someone with AVN, like, follow, and share this with your friend. Again, our free clinic. Please bring your MRIs, X-rays for tuhod or knee patients and groin patients. We're treating hip AVN, hip arthritis, especially kanang mga hip fracture. I've had patients na 1 or 2 years because their fracture was not treated. They're still trying to walk but sakit gihapon ng bugan. Guys, we have to help our parents walk back to life. So patients with hip pain from fractures, arthritis, hip AVN, and hip dysplasia are all what we want to treat, because next week, free clinic is August 27, 28, and 29 at Cebu Orthopedic Institute. That is 10 a.m. to 2:30 p.m. That is all the time we have for this evening. I'll probably share with you a educational video after this live. Hope you found value in this podcast. I'm Dr. Jonathan Flordelis, your Cebuano hip and knee specialist. I will see you next week, mga arthritis warriors. Remember, let's educate and inspire. Bye-bye.